Hi, let's talk about foreign body aspiration in children. What is it? Foreign body aspiration happens when a child inhales food or small object into the airway or breathing tube and it blocks the breathing. It is actually very common in children under 5 years of age. So, what are the common causes? Usual culprits are nuts, grapes, seeds, or any small food item. Sometimes small toys, beads, or coins also can be a cause of this problem. The most dangerous one is the button battery that can be a serious life-threatening problem. Now, what are the warning signs? So there is usually a history of sudden choking, coughing, or difficulty breathing. Sometimes the children may present with persistent coughing or wheezing. Sometimes we may see a child with what is called as stridor, which is noisy breathing, and in severe situations, child may turn blue and have bluish discoloration of the lips. So how do we diagnose? History taking is very important in this situation. There is history of choking. We will examine the child and see if the breath sounds are equal on both sides. We will do a chest x-ray, and we will also sometimes do bronchoscopy to confirm, and that is usually to confirm as well as to remove the object that is in the breathing tube. Now, in certain emergencies, the treatment includes the first aid. You may all know a maneuver called as Heimlich maneuver, but in an infant, we do something called as chest thrusts and back blows if the airway is fully blocked. We typically do a bronchoscopy to remove the object. That usually is done in the operating theatre, following which they will need to be monitored in the ICU. So how do we prevent this life-threatening problem? Supervision of the children while eating and when they're playing is very important. We always advise to avoid small, rounded, hard foods for children under the age of 3 years, and keeping the small objects and button batteries out of reach of children is crucial. Thank you.